which the vaccines work and how they work?
Well, there is a World Health Organization document, two documents, memoranda, number 1 and number 2, in 1972, in the bulletin of the WHO, number 47. And when you read those documents through the glasses of the devil, so to speak, then you basically see a recipe, a 1 to 3 step scenario, how you can use vaccines. Step 1 is to suppress the immune system, and you can do that with the toxoid of whooping cough, pertussis. And basically everybody has had a pertussis toxin vaccine. And the funny part is, in 1915, all Americans got a pertussis vaccine, so their immune systems were suppressed. The second step in the process is to introduce virus, to load the body up with viruses. And you can do that by way of a vaccine. And everybody who has had a tetanus vaccine, tetanus toxoid, sees to viral growth. So we all have had those, and yes, when we get a live virus vaccine, then these viruses will grow like crazy, helped by the tetanus toxoid. And step 3 in the scenario is that you switch on the immune system again, and you switch on preferably the T cells, which results in a cytokine storm, so to speak. And it's not, with any viral disease, it's not the viruses that will damage the body, the tissues and the organs. It is the reaction of the immune system because of the virus on your body, tissues and organs. So that is with the cytokine storm. In 1918, people basically were destroyed from the inside out, and they died drowning in their own blood. And that's been seen now also. And basically, now that I come to think of it, the young boy that died on the DTP MMR vaccine in Holland in March, Freek Hagort, he had something like this too, because he also had a lot of blood coming out of his nose or his mouth. So, I don't know. There might be a parallel, I don't know.
Okay. Tell us a little bit about Dr. Deagle's comments on the flu in Mexico.
Well, in the same radio show on the 3rd of August, the 3rd hour, he explains that this flu is no average flu. He says, for one, it is rod-shaped and not spherical. So the virus is like a rod, it's like a little thing, like straight thing, while usually flu viruses are little round things. And 2, it is lung tropic. It means it has a preference for the lung tissue. And there the virus can grow like crazy, helped by the tetanus toxoid maybe, but anyway, it grows like crazy in the lungs. And 3, it produces very high levels of interleukin-1 beta and TNF-alpha. And these are immune substances that can cross the blood-brain barrier, and they cause seizures. And the 4th point that he mentions is that this flu virus grows and goes chronic, and in a lot of people it does not go away. Usually flu viruses are out of the body after 6 weeks, and apparently this one doesn't, and that is dangerous, because this flu that is hanging on like chronic Lyme disease also does. What does that mean? If you grow a virus in someone for months or maybe years, and then a new virus comes along, what does that mean? Well, it means new recombinants. there are new viruses to be formed out of the two that are present. And basically that has happened with, for instance, the cowpox and the smallpox. People who were vaccinated with cowpox, when they had smallpox, then in their body these two viruses, variole vaccinae and variola minor, they became a hybrid virus, vaccinia. So that is happening all the time, because viruses always swap their information, their DNA information. That is how they have been around for so long time. And so basically, people are becoming this way, like walking test tubes of sometimes very virulent viruses, because the less strong the immune system, the longer the attack of the immune substances on the virus will be. So the virus will then also mutate to get away from these substances that are after his hide, so to speak.
Okay. Just a few questions from the people on the discussion board who have flagged up your very interesting interview last week. A lot of questions have been coming in about the chemtrails. Is there any evidence or any tests directly linking them to any of the diseases or any of the viruses that are currently out there?
There is proof, and there are documents that governments have been spraying people from the air, yeah. One of the sicknesses that apparently has to do with chemtrails is the strange sickness called